Melatonin is a hormone that is produced by the pineal gland. The pineal gland is a small endocrine gland that is located in the brain. Melatonin was first discovered in 1958 by a physician, researcher, and professor named Aaron Lerner, and was later described as a hormone in 1963. Here's a picture of a chemical structure of melatonin. The molecular formula of melatonin is C13H16N2O2. The molecular weight is 232.283 grams per mole. It is found that mitochondria are the organelles responsible for synthesizing melatonin. In the pineal gland, there are three main cells that help synthesizing melatonin: pinealocytes, astrocytes, and microglia. Astrocytes and microglia assist the synthesis of melatonin in pinealocytes. The whole process is started by different stimuli in astrocytes and microglia. These cells then release tumor necrosis factor, which then triggers pinealocytes to synthesize melatonin. The pineal gland secretes different amounts of melatonin depending on how much light is present. When there is light, melatonin is not produced. When darkness is present, it stimulates the pineal gland to produce melatonin. Here from the graph, we can see that the level of melatonin starts increasing at about 8 p.m. In the middle of the night, the level of melatonin reaches its highest. After it peaks, it begins to decline all the way to normal daytime low in the early morning. Humans receive information about light and darkness from the eyes to the suprachiasmatic nucleus. Suprachiasmatic nucleus is in charge of the amount of melatonin secreted by the pineal gland. Though melatonin is best known for controlling sleep and wake cycles, research suggests that it might also be crucial in other functions. Melatonin helps reduce oxidative stress for mitochondria, which also means decrease in apoptosis, improved metabolism, higher survival rate of cells. When melatonin is used as a supplement, its job as a chronobiotic is controlling the circadian clock. Many people use melatonin supplements for many different reasons, such as sleep aid and jet lag. For example, people who are actually 100% blind may have problems sleeping due to their loss of vision, since they cannot differentiate between light and darkness. The medical group Cochrane Collaboration had trials on melatonin supplements for jet lag. It is found that 8 out of 10 studies found that the melatonin supplements reduce the tiredness symptoms for travelers that travel across many time zones when they take the medication near bedtime at a destination. Though melatonin is proved to be really effective, the benefits of melatonin is really short since the hormone is quickly metabolized in around 20 minutes. In a research done by the University of Guelph, tested 30 melatonin supplements that is produced by 16 brands that sold in grocery and drugstores. It is found that 71% of the products failed to meet what the label claims to have. Many products have about 12 to 25% more melatonin than it says to have. Some of the products have nearly 5 times the amount than it is supposed to contain. The others are found to have less melatonin than there should be. Though melatonin is effective as a supplement, it does not have much side effect. It is important to keep in mind the dosage you are taking in when you are buying melatonin supplements in drugstore. However, it is suggested by psychiatrist Gabriela Gobi, MD, PhD, an associate professor at McGill University of Montreal, Canada, that it is best to get melatonin the natural way. By waking up early in the morning and getting exposed to sunlight, it increases the secretion of melatonin at night and inhibits the secretion of cortisol. Cortisol is a stress hormone. Cortisol increases as you become more stressed. By combining exposure to bright light and melatonin supplements can result in many different benefits. Sarcopenia is a huge problem in our society. Sarcopenia is a decline in muscle mass, and it starts at some point in your 30s. There is evidence that muscle mass loss is not the only symptom, but also muscle strength or power. It is found that sarcopenia muscles are caused by oxidative stress in mitochondria and not having enough radical scavenging capability. Melatonin acts as an antioxidant and radical scavenger that has low toxicity and solubility, which makes it a great solution for sarcopenia. Since the level of melatonin in the body drops during aging, people may feel like they are getting worse. Researchers reported that old adults' life quality improves when taking melatonin supplements. In conclusion, melatonin is a hormone that is secreted by the pineal gland at night that helps us sleep. It also has many other functions such as helping with sarcopenia and acts as an antioxidant and radical scavenger that also reduce oxidative stress for mitochondria. Though it is just a hormone that is secreted by the tiny pineal gland in our brain, it is absolutely crucial to the human body.